The term heart disease refers to several types of heart conditions. In the United States, the most common type of heart disease is coronary artery disease, CAD, which can lead to heart attack. Heart disease can be fatal. It is the leading cause of death in the United States. According to 2015 federal data, heart disease causes over 633,000 persons die per year, about 1 in 4.27 deaths. If they're luckier, it just can lead to serious illness, disability, and lower quality of life. Suffering a stroke may lead to paralysis, speech difficulties, and emotional problems. Following a heart attack, individuals frequently suffer fatigue and depression, and they may find it more difficult to engage in physical activities. Seriously, not all heart problems have such obvious warning signs as clutching their chest after falling to the floor. Some heart symptoms don't even happen in your chest, and it's not always easy to know what to expect. If you are 60 years or older, overweight, or have diabetes, high cholesterol, or high blood pressure, the more risk factors you have, the more you should worry about anything that could be heart-related. So, pay attention to the following 11 heart symptoms to avoid unfortunate accidents. Number 1. Chest discomfort. It's the most common sign of heart danger. If you have a blocked artery or are having a heart attack, you may feel pain, tightness, or pressure in your chest. The feeling usually lasts longer than a few minutes. It may happen when you're at rest or when you're doing something physical. If it's just a very brief pain or if it's a spot that hurts more when you touch or push on it, it's probably not your heart. You should still get it checked out by a doctor. If the symptoms are more severe and don't go away after a few minutes, you should call 911. Also, keep in mind you can have heart problems, even a heart attack, without chest pain. That's particularly common among women. Number 2. Pain that spreads to the arm. Another classic heart attack symptom is pain that radiates down the left side of the body. It almost always starts from the chest and moves outward. Some patients who have mainly arm pain that turned out to be heart attacks. But arm pain is not always related to a heart attack. Usually, the pain will appear in the area around the chest, and may radiate down the left arm, jaw, or back. Number 3. Throat or jaw pain. Just like symptom number 2, sore throat or jaw pain may not be heart-related. It's more likely a muscle problem, a cold, or a sinus problem. But if you have pain or pressure in the center of your chest that spreads to your throat or jaw, it could be a sign of a heart attack. Call 911 and seek medical attention to make sure everything is okay. Number 4. Feeling dizzy or lightheaded. A lot of things can cause you to lose your balance or feel faint for a moment. Maybe you're not eating well or you're getting up too quickly. But if you suddenly feel unsteady and you also have chest tightness or trouble breathing, call your doctor right away. It could mean that blood pressure has dropped because the heart can't pump enough blood to the body. Number 5. Nausea, indigestion, heartburn, or stomach pain. Some people have these symptoms during a heart attack, even vomiting. So, if you don't have any digestive problems or eat something bad and you're at risk for heart problems, let your doctor find out what's going on, especially if you also have any of the other symptoms on this list. Number 6. Easily exhausted. If you suddenly feel tired or feel tired after doing something you didn't have problems with before, like climbing stairs or going for a walk, arrange to see your doctor right away. These kinds of dramatic changes are more important for detecting heart disease than any pain and minor pain you may feel. Unexplained exhaustion or weakness, sometimes lasting for days, can be a symptom of heart disease, especially for women. Number 7. Sweating. Unexplained cold sweats can signal a heart attack. If this happens along with any of these other symptoms, call 911 to get to the hospital right away. Do not attempt to drive yourself, you may be in danger doing that. Number 8. Snoring. It's normal to snore a little while you sleep. But unusually loud snoring that sounds like a gasping or choking can be a sign of sleep apnea. That's when you stop breathing for brief moments several times at night while you are still sleeping. This puts extra stress on your heart. Your doctor can check whether you need a sleep study to see if you have this condition. If you do, you may need a CPAP machine to smooth out your breathing while you sleep. Number 9. A cough that won't quit. In most cases, this isn't a sign of heart trouble. But if you have heart disease or know you're at risk, pay special attention to the possibility. If you have a long-lasting cough that produces a white or pink mucus, it could be a sign of heart failure. This happens when the heart can't keep up with the body's demands, causing blood to leak back into the lungs. Number 10. Your legs, feet, and ankles are swollen. This could be a sign that your heart doesn't pump blood as effectively as it should. When the heart can't pump fast enough, blood backs up in the veins and causes bloating. Heart failure can also make it harder for the kidneys to remove extra water and sodium from the body, which can lead to bloating. Number 11. Irregular heartbeat. It's normal for your heart to race when you are nervous or excited or to skip or add a beat once in a while. But if you feel like your heart is beating out of time for more than just a few seconds, or if it happens often, tell your doctor. In most cases, it's caused by something that's easy to fix, like too much caffeine or not enough sleep. But occasionally, it could signal a condition called atrial fibrillation that needs treatment. So ask your doctor to check it out. Here are 11 signs of heart disease. Pay attention to them. If they happen to you and you are at risk for heart disease, contact your doctor for advice and treatment. Thank you for watching. See you in the next video.